Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I am going to discuss about the cranial fossa. So, in the first part of my class, during the introduction to head and neck and the osteology of the skull, I have discussed about the external aspects, the normos of the skull, that is the features which you can appreciate on various views. Superior view called as norma verticalis, so lateral view called as norma lateralis, norma frontalis, occipitalis and basalis. Now, we will see the internal aspects or interior of the skull. So, the floor of the interior of the skull is actually called as the cranial fossa. So, our learning objectives for today will be mainly the interior of the skull cap. What all the features we can appreciate on the skull cap or the calvaria. Followed by that, the boundaries, contents and features of the anterior, middle and posterior cranial fossa. Okay. So now, first let us try to start with the skull cap or the calvaria of the skull. So this is the external aspect which we have seen already in the norma verticalis. So here you are able to see the coronal suture and the sagittal suture. Now, we will concentrate on the internal aspect. So mainly in the internal aspect, what you are able to see is the impression of the superior sagittal sinus. Okay. So the superior sagittal sinus is present within the dural fold, which is called as the falx cerebri. So this makes an impression. You are able to see that. And in the front, what you see is the frontal crest. Okay. This is actually the frontal crest. Then, what else you come across is on either side of the calvaria of the skull, you see various impressions for the blood vessels, grooves you are able to see here. So these grooves are mostly, they are present over the parietal region and they are mainly formed by the middle meningeal vessels. Now especially it is formed by the veins rather than the arteries. These impressions are mainly formed by the middle meningeal veins. The veins actually intervene between the bone and the artery. Then, what else you come across is the granulations or pits. You are able to see certain pits. They are mainly formed by the arachnoid granulations. Okay. So, those are the arachnoid granulations through which what happens is the CSF is entering into the venous sinuses, into the venous blood. Okay, and these granulations or pits are more well marked, especially in the skull of the people of the old age. Okay, in advanced age, you can see these arachnoid granulations are more deeper. Then you also see the parietal foramina. Okay, so parietal foramina also can be seen. So, which transmits the emissary vein, from the superior sagittal sinus to the extracranial veins of the scalp. So, mainly you come across pits or arachnoid granulations, grooves of the middle meningeal vessels, frontal crest, and then impressions formed by the superior sagittal sinus. Next, coming to the floor of the base or the internal aspect of the base of the skull, it is divided into anterior, middle and posterior cranial fossa, and they are also present in a stepwise manner. They all don't lie in a same horizontal plane. Now, the anterior cranial fossa is actually present at a higher level then the middle cranial fossa, and the more deepest of all is the posterior cranial fossa. Okay, so the three fossa are actually present at the different levels. Now we will try to understand about these, the features on the floor, especially the cranial fossas, one by one. So first, to start with the anterior cranial fossa, you are able to see here. The anterior cranial fossa mainly lodges your frontal lobe. The frontal lobe of the cerebrum is actually resting on this anterior cranial fossa. Then, mainly this part, the frontal bone, orbital part of the frontal bone forms your roof of the orbit. And in front and sides, it is actually bounded by the frontal bone itself, squamous part of the frontal bone. This is the orbital plate of frontal bone which forms the roof of the orbit. Posteriorly, it is limited by this yellow color one. What you are able to see is the lesser wing of sphenoid. Posteriorly, it is limited by the lesser wing of the sphenoid. And the lesser wing of sphenoid, posterior most margin is very sharp. A sharp margin, you can also call it as the sphenoidal crest. Sphenoidal crest, lesser wing of sphenoid. And the two lesser wing of sphenoid are connected in between. This bar of bone is actually called as the jugum sphenoidale. It is actually called as the jugum sphenoidale. The floor of the anterior cranial fossa is formed by three bones. Orbital plate of frontal bone, as I told you. Posteriorly, it is the lesser wing of sphenoid. And in the midline, it is by the cribriform plate of ethmoid bone. Okay, so these three bones forms the floor of the anterior cranial fossa. Orbital plate of frontal bone, cribriform plate of ethmoid bone, and then the lesser wing of sphenoid. The two lesser wing are connected posteriorly in the midline by the jugum sphenoidale. So jugum is actually, it refers to the bullock cart. So when the bullock cart, what drives the bullock cart is a pair of cows. So you put a bar of wood on the neck of that cow, that is actually called as jugum or jugum sphenoidale. So contents, as I told you, mainly it is the frontal lobe of the cerebrum. Now, coming to the features of the anterior cranial fossa, what do you come across mainly? So, cribriform plate of ethmoid, it is actually cribriform means sieve-like or perforated, through which the olfactory nerve filaments they emerge from the roof of the nasal cavity, or from the olfactory mucosa which lines the roof of the nasal cavity is the cribriform plate of ethmoid, which transmits the olfactory nerve filaments. In the middle, you see a triangular bar of bone which is actually called as the crista galli. That is the crista galli. And then here you see the frontal crest. This is actually the frontal crest. The crista galli and the frontal crest gives attachment to the fox cerebri. It mainly gives attachment to the fox cerebri. And between the crista galli and the frontal crest, you have a foramen which is called as the foramen cecum. So the foramen cecum actually transmits, so here you are able to see the foramen cecum, which actually transmits a vein which is actually connecting the superior sagittal sinus with the nasal cavity. So that is the foramen cecum. Then, what other features you come across apart from the foramen cecum? So cribriform plate of ethmoid, on either side lateral wall of this, you will see two foramens. Of course, it is difficult to see in this view the anterior and posterior ethmoidal foramen. So they transmit the anterior and posterior ethmoidal nerves and vessels. Okay, on the lateral wall of the cribriform, you can see the anterior and posterior ethmoidal foramen, which transmits the nerves and vessels of the same name. Foramen cecum, crista galli, frontal crest. Then, of course, the posterior free border I told you, which is ridge-like, and the medial end of the lesser wing of sphenoid, posterior border of lesser wing of sphenoid, shows a projection which is called as the anterior clinoid process. Okay, it is called as the anterior clinoid process. Now, this anterior clinoid process gives attachment to the free border of tentorium cerebelli. This anterior clinoid process gives actually attachment to the free border of tentorium cerebelli. Between the free border, you see a U-shaped notch which is called as the tentorial notch. Tentorial cerebelli is a dural fold. The free border or the tentorial notch transmits the brainstem, especially the midbrain. So, we have discussed about the anterior cranial fossa. Mainly you have to remember cribriform plate, crista galli, frontal crest, foramen, cecum. This is posterior border of lesser wing of sphenoid, and that is the jugum sphenoidale. Then anterior and posterior ethmoidal foramen. Now coming to the middle cranial fossa. The middle cranial fossa is mainly butterfly in shape, especially you can see the lateral parts. You have a median part, then you have the lateral parts. The lateral part is actually expanded like the wings of a butterfly. So anteriorly it is limited by the posterior free border of the sphenoid bone, and posteriorly it is limited by the superior border or the upper border of petrous part of temporal bone. It is by the petrous part of the temporal bone. Okay, so that are the boundaries. Now the floor of the fossa in the midline, you are able to see it is formed with the upper surface of the body of sphenoid. Upper surface of the body of the sphenoid forms the midline floor, whereas the floor on the lateral aspect, is mainly formed by the lesser wing of sphenoid. So you are able to see the lesser wing of sphenoid. Then you are able to see the squamous part of temporal bone, inner aspect of the squamous part of temporal bone, you are able to see. And then the petrous temporal. So lateral part mainly lodges the temporal lobe on either side. The temporal lobe is there. And here on the midline, you have the hypophysis cerebri or the pituitary gland, which is situated on top of the body of the sphenoid bone, which is inside a dural fold, which is called as the diaphragma cellae. Okay, the dural fold is actually called as the diaphragma cellae. The pituitary gland or the hypophysis cerebri is present. Then, what other structures you come across? Of course, on either side of the body of sphenoid, you see the cavernous sinus. So that is the cavernous sinus within the endosteal and meningeal layer of the dura mater. And here, medially on the petrous part, anterior sloping surface of the petrous part, you see the trigeminal ganglion. The other name for it is the Gazerian ganglion. Then of course in the midline, the diencephalon rests on this top. The floor of the diencephalon, that is your hypothalamus. The floor of your hypothalamus or the diencephalon, because hypothalamus is a part of the diencephalon. So these are the contents: temporal lobe, pituitary gland, Gazerian ganglion, cavernous sinus, and the floor of the diencephalon rests in the midline. These are the very major structures which you come across as a content in the middle cranial fossa. So the middle cranial fossa alone has been shown in this picture. As I told you, it is mainly formed lateral wall by the greater wing of the sphenoid, internal aspect of the squamous part of the temporal bone, and then the petrous part of the temporal bone. Now, what are the features on the upper surface? Mainly, you see a sulcus which is called as the sulcus chiasmaticus. This is actually called as the sulcus chiasmaticus. So the sulcus chiasmaticus is related to the optic chiasma, so which lies above this sulcus, but the optic chiasma is not lodged in this sulcus. It just overhangs this sulcus. Sulcus chiasmaticus, which is limited posteriorly by the tuberculum cellae. This is actually called as the tuberculum cellae. Okay. On either side of the tuberculum cellae, you see again a small projection which is called as the middle clinoid process. Middle clinoid process. Sometimes the middle clinoid and the anterior clinoid process will be connected by a ligament, or that ligament might get ossified, forming a keratico-clinoid foramen. Keratico-clinoid foramen, through which the internal carotid artery passes. Okay, through which the internal carotid artery passes. Posterior to the tuberculum cellae, what you see here is the hypophyseal fossa. This is actually the depression which is actually called as the hypophyseal fossa. Okay, the floor of the fossa sometimes also believed to have a small opening called as the craniopharyngeal opening or canal, which is the upward continuation of this Rathke's pouch. Okay, so this is the hypophyseal fossa, and behind that, this elevation, somewhat quadrilateral in shape, is actually called as the dorsum cellae. That is actually called as the dorsum cellae. Okay, now the tuberculum cellae, then what you see here is the hypophyseal fossa and the dorsum cellae, all put together forms the sella tarsica. It is actually called as the sella tarsica. The meaning of sella tarsica means Turkish saddle. It represents a Turkish saddle. Saddle means the seat which is actually placed on the back of the horse. So might be that seat resembles of a Turkish style, so of that country. So that is why it is actually called as a Turkish saddle or sella tarsica, which is limited in front by the tuberculum cellae, behind by the dorsum cellae. On either side of the dorsum cellae, you again have a projection which is actually called as the posterior clinoid process. Okay, so that is actually called as the posterior clinoid process. The posterior clinoid process gives attachment to the fixed or attached border of the tentorium cerebelli. Okay, so anterior clinoid process, attachment of free border of tentorium cerebelli. Posterior clinoid process is actually the attached border of tentorium cerebelli. Just lateral to it, the attached border and the free border, they cross, and here it is pierced by the oculomotor nerve and the trochlear nerve. The crossing of the free border, which is going to the anterior clinoid process, and attached border, which is attached along the upper surface of the petrous part of temporal bone and the posterior clinoid process. There, here in the paramedian, what happens is the crossing over of the anterior and the attached and the fixed free border takes place. So that is the dorsum cellae, and all put together represents the Turkish saddle. Okay, so when we see a lateral view, so what is the carotid groove on either side of the body of sphenoid? You see a groove for the internal carotid artery. Okay, you see for the internal carotid artery on either side. Now here, what you are able to see is a sagittal section of the skull. This depression is the hypophyseal fossa. This is the posterior clinoid process, and the other one is the anterior clinoid process. So it represents a Turkish saddle. This is the sphenoid bone. Within the sphenoid bone, you are able to see sphenoidal air sinus. So on the side of the sphenoid bone, it is grooved by the carotid groove, which actually the internal carotid artery lies. And then what happens? The artery takes a course which passes medial to the anterior clinoid process. And that S-shaped course is called as the carotid siphon. Okay. And then what happens? It will pierce the dura mater and enter into the brain. So thereby it will terminate into the various arteries to supply your brain. Okay. So that is the carotid groove which you see on the either side of the body of the sphenoid. So here you will see the carotid groove on either side of the body. So here you have the opening of the carotid canal on the posterior end of the foramen lacerum. Then the artery will pass and bend medial to the anterior clinoid process and ascend above to the brain by piercing the dura mater. So it is very intimately related to the lateral wall of the cavernous sinus. So now, the lateral part, as I told you, mainly formed by the greater wing of the sphenoid. And then what you see here is the optic canal on either side. So the optic canal is present between the two roots of the lesser wing of sphenoid. The optic canal is seen between the two roots of the lesser wing of sphenoid, which transmits the optic nerve and ophthalmic artery. Optic nerve is the second cranial nerve. Ophthalmic artery is a branch of internal carotid artery. Okay. Then, below the lesser wing of sphenoid, you see another groove which is not very clear in this view. That is actually called as the superior orbital fissure, which is mainly formed by the lesser wing of sphenoid above, greater wing of sphenoid below, and medially by the body of sphenoid. The superior orbital fissure is actually divided into a lateral part, intermediate part, and a medial part by the musculotendinous ring or tendon of Zinn, which gives attachment to the extraocular muscles of the eyeball. So that we will speak separately in the orbit class. So for time being, this is the superior orbital fissure, and mainly it transmits your two divisions of oculomotor nerve. Lacrimal, frontal and trochlear nerves. Lacrimal and frontal are branches of the ophthalmic division of trigeminal. Trochlear is the fourth cranial nerve. Oculomotor is the third cranial nerve. Nasociliary is again another branch of ophthalmic division that also passes through that, and abducent nerve. So third nerve, fourth nerve, sixth nerve, and branches from the ophthalmic division of trigeminal all pass through the superior orbital fissure. Then other foramens which you come across on the floor of the middle cranial fossa are, so from anterior to posterior they are situated in a crescentric fashion, which transmits mainly the foramen rotundum you are able to see here. So the foramen rotundum transmits the maxillary nerve. So the maxillary nerve transmits the foramen rotundum. The foramen rotundum transmits the maxillary nerve. The next, what you are able to see here behind is the foramen ovale, which transmits the meal structures. Mandibular nerve, emissary vein, ascending middle meningeal artery, and then lesser petrosal nerve. And then behind that, what you see is the foramen spinosum. Okay, so foramen spinosum mainly transmits the nervus spinosum, meningeal branch of the mandibular nerve, and it also transmits the middle meningeal artery. Posterior to the foramen spinosum, you have the spine of sphenoid. So the spine of sphenoid, what is attached is the sphenomandibular ligament is attached, which can be seen on the inferior aspect, norma basalis. So that is the foramen spinosum. And more medially you come across, it is the foramen lacerum. So this side you are able to see the foramen lacerum, And here you can see the opening of the carotid canal. Okay, so the carotid canal inner opening is seen here, and then the anterior wall of the foramen lacerum you see the opening of the pterygoid canal. So no structures passes through the foramen lacerum vertically, but only transversely they are only the structures are passing in a horizontal plane, but they don't transmit above downwards. Okay, then what else you come across apart from the foramen lacerum? So other features which you see on the anterior sloping surface of the petrous part of temporal bone. So you have a depression here near to the medial end, that is the Gazerian ganglion. So we'll come to that. So mainly the other features which you see here is the trigeminal impression, and the impression for the trigeminal ganglion are also called as the Gazerian ganglion. So that is the area where the trigeminal ganglion is lodged inside again a dural fold called as the cavum trigeminale. Then lateral to that you have a eminence which is actually called as the arcuate eminence. This is mainly formed by the anterior semicircular canal. The impression or eminence which is produced by the anterior semicircular canal is the arcuate eminence. And then more laterally you see a thin pair of bone which is covering the petrous part is the tegmen tympani. The tegmen tympani, what happens is a thin bar of bone which forms the roof of your middle ear cavity. So not only the roof of the middle ear cavity is also contributing to the bony part of your auditory tube. This tegmen tympani turns downwards. A small bar of bone, it actually turns downwards and divides the petrotympanic fissure into a petrosquamous and squamotympanic fissure. So that again you can see in the temporal bone individually on the external aspect, the tegmen tympani. So mainly the other features posterior laterally is the trigeminal impression, medially lateral to that is the arcuate eminence, and then the tegmen tympani. If you carefully observe the tegmen tympani, you can see two small canal. They transmit the lesser petrosal nerve and the greater petrosal nerve. Hiatus for lesser petrosal nerve will pass through the foramen ovale. Okay, and greater petrosal nerve will actually transmit to the through the facial canal mainly. Okay, so that is about the lateral features. Now coming to the posterior cranial fossa. So on the posterior cranial fossa, what are all the structures you mainly come across on the posterior cranial fossa? So the limit is mainly formed by the superior border of the petrous part of the temporal bone, and in front by the dorsal surface of the sphenoid. It is present in a more deeper plane. It is the deepest of all the fossa. What does it lodges? Now, in living state, there is a fold, the tentorium cerebelli, which divides the posterior cranial fossa into a supratentorial compartment and infratentorial compartment. So here, part of the tentorium cerebelli has been removed. So supratentorial compartment mainly lodges your occipital lobe. Okay, so it lodges your occipital lobes of the cerebrum. Infratentorial compartment lodges your cerebellar hemispheres. It lodges your cerebellar hemispheres. Okay. Then what else? Brain stem actually passes through this free tentorial notch. Okay. So the free tentorial notch, the brain stem passes. So here kindly excuse me for this, instead of occipital lobe, it is given as a temporal lobe, and this that is one thing I just want to tell you. This is cranial fossa, posterior cranial fossa. So some error during the formatting, it has actually been retained as clinoid fossa. Auto correction most probably sometimes happens. So contents, I told you occipital lobe above the tentorium cerebelli, cerebellum in the infratentorial compartment, vertebral vessels, vertebral artery you can see, and from that giving branches which is going to pass through the foramen magnum. So branches from the vertebral artery, that is anterior spinal artery, posterior spinal artery. Then some dural venous sinuses you are able to see here, mainly the transverse sinus, right and left transverse sinus within the dural folds, and this is the straight sinus which you are able to see here, the point of attachment of the falx cerebri onto the tentorium cerebelli. This is your right and left transverse sinus, which is continuing as the sigmoid sinus. The S-shaped sinus is the sigmoid sinus. Along the attached border on the petrous temporal, upper border of the petrous temporal, is the superior petrosal sinus. So the superior petrosal sinus coming and draining into the sigmoid sinus, the place where the transverse continues as the sigmoid sinus. Straight sinus, superior sagittal sinus continues as right transverse sinus, whereas the straight sinus continues as the left transverse sinus. Then what else you come across is cisterns. Cisterns of the brain, mainly the cisterna pontis and cisterna magna. So here you are able to see that is the cisterna pontis, and here the largest cistern is actually called as the cisterna magna. So these are the places where the pia and arachnoid are just away from each other, and it is filled with the cerebrospinal fluid. So it is actually the subarachnoid space, a little bit deviated from the pia mater. So you have a large collection of the CSF here. So cisternal puncture mostly is performed in cisterna magna, but it is a very dangerous procedure. You should be very, very careful performing this otherwise, because your vital centers is present in the medulla, your cardiac and the respiratory centers. So if it is injured, then naturally it might prove fatal. So CSF is actually withdrawn mainly through the lumbar puncture in the lower part at the L2, L3 level. So if it is not possible, then only they go for cisternal puncture. So cisterna magna, cisterna pontis, same way you also have interpeduncular cisterns. So cisterns of the brain, they are mainly the places where CSF is present. So coming to the boundaries of the posterior clinoid fossa. So above I told you tentorium cerebelli, and floor is mainly formed by the sphenoid bone. Then basilar part of occipital bone. So basi occiput it is called as. And then squamous part, very large area is formed with the squamous part of occipital bone. Then you see a part of the temporal bone. So mainly the petrous part and the mastoid part contributes to some extent anterolaterally and laterally. Okay, that is the petrous part, posterior sloping surface. This is the anterior sloping surface. On the anterior sloping surface only we have seen the trigeminal impression, arcuate eminence and tegment tympani. So these are the bones mainly forming the, and front it is limited by the dorsum sellae. So this is the projection. On either side of the dorsum sellae what you have is the posterior clinoid process. On the occipital bone you see the internal occipital crest. The internal occipital crest slowly diverges as it approaches the foramen magnum to enclose a fossa, the vermian fossa. The vermis of the cerebellum is actually lodged here. So from the internal occipital protuberance you can see the internal occipital crest, and the falx cerebelli is actually attached. Falx cerebelli. On either side you see the impressions for the transverse sinus, and this part is the impression produced by the torus hierophilia or the confluence of sinus. It is actually the confluence of the superior sagittal sinus, right transverse sinus, superior sagittal sinus, and you are able to see the right transverse sinus, occipital sinus. So it is a confluence and it is called as the torus hierophilia. What are the features you come across mainly is this posterior sloping surface is actually called as the clivus. So this is actually the posterior sloping surface which is contributed by the posterior surface of the sphenoid and also from the base occiput. So what is related to the clivus? The brain stem. Actually the brain stem is actually related to the clivus and separated. The brain stem is separated from the clivus by the basilar artery. Okay. Then foramen magnum, I have discussed well and enough about the foramen magnum in the norma basalis. It has an anterior part and posterior part. Anterior part mainly transmits your ligaments, apical ligament of dens, membrana, tectoria, cruciate ligament. Posterior part, lower part of medulla oblongata, and then your vertebral vessels, then anterior and posterior spinal vessels, then spinal part of accessory nerve, meninges. So all those things are actually passing through the your foramen magnum. So internal occipital crust, which is actually seen here, and it deviates to enclose the vermian fossa. This is actually the fossa for the cerebellum, where the cerebellar hemispheres lodged on either side of the internal occipital crust. So that is the internal occipital crust for you. Groove for the transverse sinuses on either side, right and left transverse sinus, which continues as the sigmoid sinus. Sigmoid sinus will pass through the jugular foramen as the internal jugular vein. Then impression for the torus hierophilia or the confluence of sinus, which we have already seen. Then this here you are able to see the jugular foramen. Jugular foramen mainly transmits your anterior part inferior petrosal sinus. So at the junction of this base occiput and the petrous part, you have the inferior petrosal sinus, which passes through the jugular foramen and then terminates into the internal jugular vein. That is actually a communication, inferior petrosal sinus, between the internal jugular vein and the cavernous sinus. Middle part of the jugular foramen transmits your 9th, 10th and 11th cranial nerve, glossopharyngeal, vagus and the accessory nerve. Posterior part of the jugular foramen mainly transmits your internal jugular vein, which continuation from the sigmoid sinus. Okay. Then you have the internal acoustic meatus. So internal acoustic meatus mainly transmits 7th cranial nerve and 8th cranial nerve. Sometimes they tell 7th nerve and nervus intermedius also. Intermedius is nothing but the sensory part of your 7th cranial nerve. Sometimes referred to as the 13th cranial nerve. So internal acoustic meatus transmits 7th cranial nerve, 8th cranial nerve and labyrinthine vessels, labyrinthine artery. So these are all the structures which are transmitted by the internal acoustic meatus. And this is your jugular foramen. And here in the anteriorly part, you see the anterior condylar canal or the hypoglossal canal. The anterior condylar canal or hypoglossal canal mainly transmits your 12th cranial nerve. Same way you also have a posterior condylar canal which transmits a emissary vein. Okay, that mainly transmits the emissary vein. So foramen magnum you are able to see here, and that is your internal acoustic meatus. So thank you very much for your patient listening. We will meet again in one more lecture.